Welcome back to our live coverage from Devex World 2018. I'm joined here by Deena Buford, Global Medical Director for ExxonMobil, and Jim Jones, Executive Director of the ExxonMobil Foundation. Thank you both for joining us. Now, Jim, earlier today you both took part in a roundtable discussion with a number of leading actors across sectors to talk malaria, which is of course a disease that still claims the life of one child every 2 minutes, a shocking statistic. There's been of course tremendous progress in recent decades, but there are still a number of threats and challenges, some of them emerging. We heard about resistance, we heard about substandard medicines, bed net usage, vector control, even climate change. What was your take on the discussion, Jim? And is there room for optimism here?
So this is a really important issue to ExxonMobil. You know, when we were constructing a pipeline back in 1999-2000 between Chad and Cameroon, the number one cause of loss of productivity in that project came from malaria. And that's the kind of thing that really makes corporate CEOs sit up and take notice and realize we have to do something about this. So ExxonMobil became really involved in the fight against malaria at that time, not only within our workforce, work that Deena is responsible for, but also in the communities. So we've seen a precipitous decline in the rates, and as you mentioned, in malaria, both in death and caseloads, since that time, working in global partnership. The fear, I think, in recent years is maybe some of that success has plateaued. So something that we're looking at is what are those issues that we really have to be facing moving forward? Resistance, as you said, is a really big problem and something that we're clearly focused on. Substandard medicine is also an issue. But overall, how are we going to inspire those countries which have the highest degrees of malaria to really try to redouble their efforts to work to eliminate the disease in their countries?
And Deena, as a global medical director for Exxon, what really resonated for you from today's discussions, and how are you responding to some of these key challenges?
Right. Well, first of all, it was just an honor to be in the room with so many notable people in the fight against malaria, and to have an opportunity not for formal presentations, etc., but just to sit around a table and share ideas. So that part was wonderful. As I said this morning, there are a few things that every morning when I get up and I think about our operating locations that are in these malaria risk areas, I think about a few things. One of the things that you just mentioned was complacency. We've had such tremendous success within our company and then around the world with malaria. I mean, who would have thought that the death rates would have plummeted the way that they did in the past decade or so? So while on one hand we celebrate the successes, we've seen some slowing and actually some reversal of our progress in some areas. So of course I wonder if that's going to happen within ExxonMobil as well, because we're members of the communities in which these stats are happening. So we want to keep current, we want to keep evidence-based, we want to join in the fight and help promote and keep the progress going.
I think something that struck me from discussions this morning was really this sense that disease interventions against Ebola, for example, dominating the headlines around the world, and many headlines on Devex.com as well. But you know, we can't forget about malaria, can we? What do we need to do to make sure that it's still hitting the headlines, and we're still making efforts towards accelerating progress?
It's an interesting phenomenon, because I think the other thing that I mentioned was distraction. There are certainly many things that are happening in the world today, particularly in global health, that can distract us. I think sometimes people say, malaria, you know, I've heard that, I heard we were making progress. It's these other things, whether it's Ebola or Zika or MERS, et cetera, that we need to put our effort and our resources into. And I think what we've seen in the past, if you take your foot off the accelerator of malaria, it's an amazing disease it will come back, and it can sometimes come back in a very explosive manner.
So complacency, the watchword there. There is good news though. We heard from Dr. Tedros at the WHO yesterday that Paraguay is the latest country to be cleared of malaria, certified as malaria-free, and a number of other countries in that region in the Americas are really sort of scaling up activities to help get there too. What was your sense, both from the discussions here, about what needs to happen next, and how do we, in practical terms, capitalize on some of these successes, and as you say, Deena, really avoid complacency and make sure that we're really hitting the mark every time?
So I think Paraguay is a great example. We're all celebratory in terms of what Paraguay was able to do. And before that, Sri Lanka, which is a country that took us all by surprise, that Sri Lanka would have been certified malaria-free as well. So those are definite successes, and they should be celebrated, and we should look at those best practices and look at what those countries were able to achieve and do, and replicate those in places where they're appropriate. However, we have, as Deena mentioned, seen some backsliding in places like Nigeria and the Democratic Republic of Congo. That's why I think it's really important that we look at what the Global Malaria Program is doing at WHO right now in their new 10+1 initiative, to look at those 10 countries that have the highest caseloads of malaria in Africa plus India, and try to figure out how do you really get to the belly of the beast and look at where infection rates are the highest and where transmission is most intense.
And I suppose one way to get there is through more robust financing. We've heard about a raft of funding announcements covered the significant UK government support, of course, for the Global Fund. There's been other pledges from the Gates Foundation, from GSK and Novartis and the private sector, among others. Is there a sense that there's a clear sense of purpose now among our community, and how important are partnerships towards that effort?
So I think one thing that's really interesting about partnerships, that I think they've really matured in the past 10 years, where we used to talk about public-private partnerships in global health, and Deena and I are members of a roundtable at the National Academy of Medicine on this very subject. And I think those have really kind of taken off into a new sense. Let me give you an example. I think in the past, one thing that we used to talk about a lot in terms of public-private partnerships is that the work is done by others and the private sector is there to write checks. And I think that has really matured and changed in a big way. There are things that we do on a daily basis in our jobs, core competencies that our company and others in the private sector have, that really can be leveraged and used to the best advantage for some of these issues. So for example, we know money's important and we're happy to contribute to the fight against malaria, but we also work together to really kind of look at project management, government relations, advertising, marketing, those issues that really kind of move the needle for us as a company, that we can apply for these kind of issues too.
So leveraging your experience as a private sector actor, making sure that you as a company have a seat at the top table when it comes to malaria discussions. What is the sense of optimism at Exxon about really moving the needle on progress?
Oh my goodness, you have to be optimistic. You saw the people at the breakfast this morning and you could feel the optimism around the table.
Yep.
And you could feel people joining together, discussing what each of their strengths and capabilities were. So I remain optimistic. Look at what we've done thus far. And I think the key here is that word partnership. If you even heard this morning, they were saying, let's break down the traditional model of country by country, and let's do it in a bigger way across regions. And I think there's something there. That we can utilize our partnerships and our expertise to press forward in the fight against malaria. I'm convinced.
It's one of the beauties of this conference, to be honest with you,
Absolutely.
Because coming to Devex is really interesting in the sense that what we did this morning at breakfast carried over into the hallways and everything that you see behind us. And so when we left there, we were able to identify a number of things that were challenging and that are concerning to us moving forward. But then leaving there, we heard so much more about even what do you do with the 1 billion bed nets that have been distributed already that need replacement? How do you repurpose them? Can they be recycled? Or, what's the effect and what we're trying to do about bolstering health infrastructure in countries where we're operational? So there were lots of other things that happened here in the corridors that I think will carry us through the rest of the day, frankly.
Absolutely.
And I'm afraid we have to leave it there, but we can continue this conversation offline and among the 1,000 participants here at Devex World 2018. So thank you, Deena. Thank you, Jim, for joining us. And of course, to our viewers, thank you very much. Stay tuned as we bring you all the latest from Devex World 2018.